than misdiagnose a malignant one. What does this mean? Actually, the breast lump is not always cancer, isn't? But you have to rule out the cancer. Clear? So overdiagnose is okay. Some clinician will say that no, this don't need any further evaluation. This is fibroadenoma, and this is not going to turn malignancy or not going to be. This is a fibroadenosis, and it's not going to be malignant. So we don't need any further evaluation. But still cases are there. Okay, still cases are there where there was initially clinically diagnosed as fibroadenoma, and it was found to be a malignant one later on. Okay, so any breast lump, there is a dictum in surgery, any breast lump suspect of malignancy until and unless it is diagnosed otherwise. Okay, so I remember a case of breast lump in, I think, 50 years old lady, and she was being treated by a homeopath for around 5 to 6 years. Luckily, the breast lump was at its position and was not going faster. Okay, so when I just examine clinically, I think the homeopaths don't bother to examine clinically as well. Don't touch the patient is the typical homeopath's dictum. But if in younger lady, it is for male physician, it is quite difficult for examination, but the female physician always can examine the breast in the younger ones. But in the older ladies, you can easily examine. Just put palm or fingers on the breast where there is discomfort, and you will get an idea. When I put my hand on the swelling the patient was complaining of, that was hard, that was firm, that was fixed. Okay, so that was suspected to be something otherwise than fibroadenoma. Actually, fibroadenosis, diffuse fibroadenosis, is also hard, firm, and immobile. Fibroadenoma is mobile, okay, and not adherent to the skin. But fibroadenosis clinically will give that feeling of a malignant. So I asked for simple USG of both breast. Okay, mammography is actually has been outdated nowadays. You can say mammography. Still, some homeopaths are writing it. Okay, mammography is required where there is no lump present clinically. Clear? Mammography is required where there is no lump present clinically. Means clinically you cannot appreciate the lump is there. So mammography is quite outdated, except in some exceptional cases reserved for the specialist. Okay, so mammography, don't write mammography. Far easier than mammography is sonography, ultrasonography. Ultrasonography of the breast. I just asked the patient go for an ultrasonography of the patient of both breast, and that ultrasonography revealed something: heterogeneous mass. Okay, it was not clear about what it could be, and that heterogeneous mass led me. I was not prescribing any medicine till then. That heterogeneous mass led me to go for an FNAC, and this is the last investigation you want in your hand to confirm. This is the last FNAC. I would advise, don't ask for a biopsy at your clinic, because biopsies create such a havoc in the patient that it won't remain or it won't be with you. Better if you are asking for a biopsy, refer to a specialist. Okay, so that sonography nowadays will come with this BIRATS, breast imaging reporting and data system. Okay, so nowadays it will come if you are referring your patient to a good sonographist or a good lab where there is a good sonologist is available. I have discussed in initial few classes, I think in some backache or somewhere else, I have discussed that a good sonologist will enhance your prescription. So I found some good sonologists and good lab diagnosis in Calcutta where I am practicing, and in nearby areas of me. You find your at the place you are practicing nearby clinics or labs where there is a good sonologist is available. So Dr. P. Sengupta is one of the sonologists I depend upon in Dr. Roy's diagnostics. A female sonologist, and she is very much helpful with her report. Okay, so BIRATS are nowadays is given with ultrasonography, not with all the sonographic report. A good sonologist will also give you this BIRATS rating. Okay, so 1 is negative for 0 and 1 is okay, benign is okay. 0 or 1 means nothing is found in the this breast. Benign findings 100%. Okay, up to 2 it is good. See BIRATS ranking here. BIRATS category 3. Category 3. Okay, category 2 you will find 1, 0 you will find 4, 5 you will find. Probably benign finding, follow-up studies needed. Well-defined solid mass in the right breast. Well-defined solid mass. Well-defined. Whenever you are getting a well-defined mass anywhere, well-defined is the sign of benign. Okay, ill-defined. Well-defined, ill-defined. Ill-defined means outline is not clear, or maybe that outline is heterogeneous. Okay, outline. Well-defined means outline is clear. Outline is very much clear. Okay. Acha, heterogeneous and homogeneous mass. Heterogeneous mass should suspect you of malignancy. Homogeneous means all are the cells which should be there. Or heterogeneous means cells are metaplastic in nature. Cells where there should be squamous cell, there is some columnar cell is present. Where there should be columnar cell, there are cuboidal cells are present. So heterogeneous metaplasias are there. So homogeneous, heterogeneous, and well-defined means the outline is very much clear. Ill-defined, outline is not clear. Okay, so BIRATS ranking was given in this case as 3. Let us see what is 3. 3 is probably benign, 2% chances of cancer. Whenever you are getting a BIRATS ranking of this breast lump, go for a FNAC at least, and FNAC will confirm the diagnosis. Okay, if it is fibroadenoma 3 and more. 5 and 6 are almost confirmed for malignancy. 3 and 4 is suspicious of malignancy. So in these cases where you are getting viral ranking from the sonologist as 3 and 4, just how these viral rankings are given, that's not our business. You just be aware of this viral ranking. 3 and 4 will lead to an FNAC asked by you. Okay, so where this better to overtreat a benign diagnosis, I will say over diagnose a benign breast lump than misdiagnose a malignant. Means you are asking for USG, you are asking for FNAC, that's okay. Okay, to rule out the cancer. And in USG, if you are getting an USG like this, well-defined solid hypoic nodule on the outer quadrant of the right breast, suspected of fibroadenoma, well-defined fibroadenoma. But outer quadrant also should made you suspect of malignancy. Here it is also viral rankings are not giving. See, somewhere a sonologist is giving his or her opinion without any viral rankings. Okay, a good sonologist will give some viral rankings. Okay, prolactin should be, in cases of breast lump, prolactin may be increased. In cases of galactoria, okay, we will discuss later on. This is a normal appearing breast. Bilateral fibroadenosis. Okay, this is a case of breast cancer. Breast cancer usually comes, if it is coming in this stage, older lady, it cannot be cured, or palliative measures should be adopted. Neither surgery can be done nor homeopathic medicines will reverse this. Means can reverse it. It may take 10 years of time. Patient won't live to 10 years. Okay, so this could be a finding. The swelling of the arm. I remember in the very initial days of my practice, around 2016 or 15. Okay, so I got a case of breast lump with this swelling. Why I was called for? Because there was no other treatment option available. Okay, the lady was 86 years old. The lump was there in the breast, and it was suggested for surgery, but surgery was not an option in that 86-year obese lady. Okay, so this swelling was there of the arm. So somehow I reached at Rustox. Okay, my medicine was Rustox. Somehow there was some rubric or something. So whenever I get this type of swelling of the hand due to breast lump, my first source, my first medicine would be Rustox. Since then, I just try Rustox in 6 potency or LM potency. Lower potency or LM potency will help. Okay, so Rustox was given, and with my surprise, too much reduce of that lymphadenopathy, lymph swelling. Actually, this is the blockage of the lymphoid channels. So there was swelling in the hand. So the Rustox was given with much effect. I think I gave Rustox 6 or 30 or in LM potency repeated dose, and the swelling was reduced. Further, I gave calcarea carb, because you know that Rustox is an acute of calcarea carb. Like belladonna, Rustox is also an acute of calcarea carb. Rustox, belladonna, and podophyllum are acute of calcarea carb. Here, belladonna, fever, Rustox, the joint complaint or any other pain or any other complaint. Podophyllum usually diarrhea. Okay, diarrhea in calcarea children, think of podophyllum. Fever in calcarea children or tonsillitis in calcarea children, think of belladonna. Arthritis or any other Rustox like complaint in calcarea carb constitution, think of Rustox. Okay, and further this I let me show the diagram. Means let me represent here with other way. This is actually side topic. I use this. Wait, I use this this diagram. I use, see, podophyllum, Rustox, belladonna. Okay, all these are related to calcarea. Okay, and this calcarea is related with thyroidinum. So I often prescribe in this manner. And diagnosis thyroidinum in the family. Calcarea constitution is there, and calcarea is not working. I am giving thyroidinum, or I found some thyroidinum like thing in the family history, in the past history, and going to prescribe some on some recent complaint, belladonna. Okay, so I can bypass calcarea in between thyroidinum like complaint, thyroidinum like constitution, and some diarrhea is there. I may think of podophyllum and like that. So many medicines have this kind of relation. Many medicines many you will develop in during your practice things like that very easily. So you are thinking of thyroidinum at the base and prescribing belladonna, then going to calcarea, then going to thyroidinum, like that. Okay, so this was side topic. I used to analyze my medicine in this fashion often. So one more thing, calcarea iode is one of the medicine for breast lump. Calcarea iode, though calcarea floor has been given in literature, nodocytes in the breast, you will find it in Borix Mathematica, but I have not seen calcarea floor acting on the breast. Calcarea iode of the breast lump during puberty. Usually during puberty there is the growth of goiter, there is goiter, there is nodules on the neck, could be cured with calcarea iode, and there is this lump in the breast, could be cured with calcarea iode. So in this manner, calcarea, all the calcarea group will come here. All the calcarea group, calcarea iode, floor, ars, you may think. Okay, the calcarea family is in this line, and above that thyroidinum, and below that podophyllum, Rustox, and belladonna. Now come back to our presentation. Entire screen, this. Okay, so that was the case from my initial practice. Okay, this is a recent case of breast malignancy. This breast